Ethics is defined as thoughts, judgments, and actions on issues that have implications of moral right and wrong. Personal, professional, and organizational ethics all contribute to the way in which the medical assistant approaches patient care. When presented with a situation that challenges your personal ethics, study and consider the issues carefully before you respond.
Good morning, Jessica.
Hi.
Hi, looks like you're getting ready for your day. Have you gotten to Mr. Carter's file yet?
No, I haven't.
Well, he's going to be visiting us from the county correctional facility today. Are you going to be okay working with him?
You know, could I have a couple minutes to think about it? Maybe look over his chart?
Of course. That's why I wanted to give you a heads up. I'm going to go check on Carol, and then I'll come back and see if you have any questions.
Look at each issue at hand as a separate ethical problem and apply the ethical decision-making process to each. Begin by examining your own immediate reactions. It may help to make some notes. Reactions may include curiosity, fear, anger, and/or confusion about the situation. Gather relevant information by researching the problem.
I can tell by your face that you've got some questions. What would you like to know?
Well, first, what did he do?
Does that really matter? I mean, he's a patient and he needs care, and we're obligated to provide that.
But is he safe to be around?
Well, that's a good question. Mr. Carter will have a guard with him here the whole time.
Identify the type of ethical problem each issue represents.
Okay, that's a good start.
Determine your views on each issue.
It really comes down to my personal ethics. If I take fear and curiosity out of it, it really leaves one issue. I just have mixed feelings about providing care for a criminal when there are so many people that need help that we can't care for.
Decide which ethical approach to use.
Well, let's think this through. I mean, it's not Mr. Carter's fault that some people can't get the care they need, right? It really has nothing to do with him. Unfortunately, that's a result of the disparities in our healthcare system.
Explore practical alternatives.
Okay, yeah. If we didn't provide care for Mr. Carter, he'd have to go to another clinic.
Right, and it would likely be a clinic farther away from the prison, which would be more time and more money, and there's no guarantee that he would get the quality of care that we can provide.
Reach a conclusion that seems right for you.
Yeah, you're right. That would make matters worse, wouldn't it?
Examine the position of the Medical Assisting Code of Ethics on each issue. Take a look at the Medical Assisting Creed and Code of Conduct.
I just want to do what's right.
And that's a really good attitude to have. You know, sometimes looking at the Code of Ethics can provide some guidance. Why don't we look at that?
Continue this process until each ethical issue has been addressed.
Huh. Looks like these were written just for this situation. The code says to render service with full respect. And the creed says I am dedicated to the care and well-being of all people. I guess I got so caught up in thinking of Mr. Carter as a prisoner and stopped thinking of him as a person.
Be careful not to impose your personal ethical views on your patients.
Yeah, you know, sometimes it's hard to sort out our immediate emotional reaction from what the right thing to do is. But I really think you've done a good job here.
Interact with patients in a professional way, regardless of your or their ethical views.
Well, I appreciate you taking the time this morning. I know I can provide excellent care for Mr. Carter. That's why I became a medical assistant.
Reevaluate those views periodically. Apply your new knowledge and experiences to see if your views have changed.
Great. You know, it's not always easy to know what the right thing to do is, but keep asking those tough questions. That's part of what makes you a really good MA.